I'm Dr. Bob McGrew from Cornerstone Family Medical Group in Modesto. This video segment on the hepatitis B vaccine, preventing chronic liver disease, is part of a series of videos giving information on commonly recommended immunizations. This video is intended to supply general information. For specific decisions about your health, you should always talk with your personal doctor. The hepatitis B virus can cause very serious infections, both acute, which is soon after a person gets the virus into their system, and chronic, which means the virus stays in the liver for many years. Worldwide, the death and misery caused by hepatitis B virus infection is staggering. More than 300 million persons have chronic, lifelong infections. More than 600,000 persons die worldwide in 1 year from hepatitis B-associated acute and chronic liver disease. Is hepatitis B widespread in the U.S.? Unfortunately, it is widespread. In 2001, for instance, there were about 22,000 people who became acutely ill with the hepatitis B infection. An additional 5,000 to 8,000 people became chronically infected without becoming acutely ill. An estimated 700,000 to 1.4 million people in the U.S. have chronic lifelong infections. So it's good that there is an effective vaccine that can prevent this serious infectious illness. Let me tell you more about the illness caused by hepatitis B infection, and then I'll discuss the vaccine. First, it would be good to clear up any confusion caused by the fact that there are 3 kinds of infectious hepatitis viruses that you may commonly hear about. All 3 are named by letters: hepatitis A, hepatitis B, and you guessed it, hepatitis C. Yet these are very different viruses, so I'm discussing the hepatitis A vaccine in a separate video segment. Unfortunately, there is no vaccine yet available to prevent hepatitis C. The hepatitis B virus is transmitted from one person to another through exposure to body fluids. The most common mode of transmission in the U.S. is by sexual contact, either heterosexual or homosexual, with an infected person. Another common mode is sharing of contaminated needles during injection drug use. Other possible modes of exposure to blood include tattooing, ear piercing, and acupuncture, as well as needle sticks sustained by healthcare workers. In other parts of the world, transmission from an infected mother to her infant at birth is very common. The virus causes acute inflammation of the liver in about half of the adults who get the virus into their system. A smaller proportion of kids will become acutely ill. This means that the liver's function becomes disrupted over a short time span as the body tries to fight off the virus. Since the liver is an important organ for making proteins and enzymes that we need to live, the acute infection caused by the hepatitis B virus can make a person very ill. Once the virus gets into the person, it takes about 4 months for the person to become acutely ill. Usually the infected person develops fever, tiredness, lack of appetite, nausea, and abdominal pain over a couple of days. Then the urine gets dark, the bowel movement gets lighter than normal in color, and the skin turns yellow-orange, which is called jaundice. The infected person usually is jaundiced for 1 to 3 weeks, but may feel tired for months afterwards. About 1 or 2 out of 100 persons with acute hepatitis B infection become severely ill, and 200 to 300 Americans die every year from acute hepatitis B infection. Now, not everyone who is infected with hepatitis B becomes chronically infected. Some people's immune systems are able to get rid of the virus. Chronic infection is more common if the person becomes infected as a child, and is less common if infected as an adult. Most of the serious complications of hepatitis A are due to chronic lifelong infection. People with chronic infections frequently feel fine and may not even know that the virus is present in their body. But in at least 25% of these people, there is progressive liver damage being done. This is called chronic active hepatitis B, which leads to destruction and scarring of liver tissue, which is called cirrhosis of the liver. This often causes fatigue and other symptoms of poor health. About 4,000 persons die of this kind of liver damage each year. Up to 1,500 persons die of liver cancer arising out of hepatitis B-related liver damage. Now I'll discuss the hepatitis B vaccine. It is given into the muscle by a shot. There is no live virus in the vaccine. It is now part of the routine vaccination schedule for children. The first dose is recommended at birth, with the second dose given 1 to 2 months later, and the third dose given 6 to 18 months later after the first dose. Any child up to 18 years of age who missed getting the hepatitis B vaccine as an infant should be sure to get the vaccine. The hepatitis B vaccine is not routinely recommended for adults. However, adults of higher than average risk of getting hepatitis B infection should consider getting the vaccine. Who might this be? Well, remembering how hepatitis B is transmitted, any sexually active person who is not in a long-term, mutually faithful relationship should consider getting the protection of this vaccine. Also, if a person's sexual partner is positive for chronic hepatitis B infection, then that person should get the vaccine. A brief list of some other people for whom the vaccine is recommended include injection drug users, healthcare personnel, and persons on kidney dialysis. International travelers going to regions with high levels of chronic hepatitis B infections, such as Southeast Asia, should consider the vaccine. A new recommendation for use of this vaccine concerns people with diabetes of either type 1, which is insulin requiring, or type 2, adult onset diabetes. It turns out that hepatitis B is more common in them, probably because of poor technique in testing finger-stick blood sugar levels. So the hepatitis B vaccine is recommended for all diabetics of either type under age 60, and it is optional for those over 60 years of age. Finally, if you want to get the protection of this vaccine, but don't fall into any of the above groups, then ask for the vaccine. You don't need to tell the doctor or nurse why you want it. Does the vaccine work? Yes. Close to 100% of people develop long-term protective immunity from this vaccine. There are a few health reasons to skip this vaccine. The major reason would be if there was a severe allergic reaction to a prior dose of the vaccine or to a vaccine component. Such allergic reactions are rare. A moderate or severe acute illness such as influenza would be a reason to postpone routine vaccination for a couple of weeks. But people with mild illness like a common cold need not postpone receiving the vaccine. The vaccine may be given during pregnancy. The hepatitis B vaccine is safe. Mild and self-limited reactions at the injection site, such as pain, redness, or swelling, are reported in 3 to 9% of children and up to 29% of adult recipients. 3 to 20% of people complain of mild fatigue or low-grade fever. There's no evidence that giving the hepatitis vaccine to babies shortly after birth causes more fevers, allergies, or neurological problems in the newborn period. You can review more information about the hepatitis B vaccine at www.cdc.gov/vaccines. I derived much of the information for this talk from the Pink Book article on the vaccine at the CDC website. The mission of the CDC, the Center for Disease Control in Atlanta, is to save lives and protect people. Another website with excellent information is that of the Immunization Action Coalition at www.vaccineinformation.org. Since about 1 million people have chronic hepatitis B infection in the U.S., there's a substantial risk that your child could become infected with this virus, particularly in the teenage years when risk-taking behavior is very common, even among good kids. Also, you may be at risk as an adult if you are in one of the high-risk groups we mentioned. Please make sure that you and your loved ones have the protection of the hepatitis B vaccine.